78 cases of Ebola have now been confirmed in an outbreak in the DRC's eastern North Kivu Province, and the United Nations has raised alarm bells about the deteriorating humanitarian situation in other parts of the country.
The World Health Organization is warning that the number of cases is expected to rise, with 44 people already confirmed dead from the hemorrhagic fever. Complicating matters further is the dire humanitarian situation in a country in which 13 million people already need assistance.
This was WHO's Director General on a recent visit to the region. With the outbreak in North Kivu's Beni region, which shares borders with Uganda and Rwanda, coming just days after an initial outbreak in Equateur Province was declared contained.
The active conflict is the other challenge, and the red zones which are inaccessible. And of course, in addition to that, the high population density, the high population movement, not only internally but across borders into neighboring countries, are the serious challenges. What we are asking the international community is to help in ensuring access to the inaccessible areas. And also we call on the warring parties for cessation of hostilities, because the virus is dangerous to all. It doesn't choose between this group or that group.
There are dozens of armed groups operating in North Kivu, with over 120 incidents of violence recorded since January this year. The area also has a high population density that, unlike Equateur Province in the west, could further complicate the response.
This is a very dangerous enemy, and we have to be vigilant, and we have to follow 24/7. And we need to be very flexible in changing the way we tackle the virus based on the situation. We have to be pragmatic, and that's what we're saying. So at all levels, including myself, we're focused on following up the situation, and the follow-up is 24/7, and we will do or decide the right thing based on the situation.
WHO says it's increasing the number of health professionals on the ground, while other UN agencies have also ramped up their response.
Our role as UNICEF is basically taking technical leadership role in 3 areas. The first is on communication. We are responsible for ensuring that community members understand what they need to do to prevent and protect themselves. The second is on water, hand washing and hygiene, to make sure that people do not transmit infection by adopting good behaviors. And the last is to provide psychosocial support to families, including children of cases who are affected by Ebola. And this is why we partner with everyone, including WHO and the government, to contribute towards the response to Ebola outbreak in the DRC.
So far, there have been 57 cases, 30 confirmed and 27 suspected, while 41 people have died in the eastern DRC, already surpassing the number of cases reported in the more sparsely populated Equateur Province in the west of the country. As part of the response, the government has begun the use of an experimental treatment known as MAB114, the first time it's been deployed in an active outbreak. WHO says patients who've received the drug are reportedly doing well, while vaccinations are also ongoing in the region. Bryce-Pease, SABC News, New York.